All right, welcome everyone. Welcome to the second in our series of 5 webinars that are dealing with peer support during the time of the COVID-19 pandemic and beyond. These are free webinars that are presented by N.A.P.S, the National Association of Peer Supporters, and we're a member organization for the peer support profession, and our mission is to grow peer support by promoting the inclusion of peer specialists throughout healthcare and other community systems. We are recording this webinar. It will be posted on the N.A.P.S website probably later today or tomorrow. The chat actually is not recorded in the webinar. But if we're taking questions and you're on, we will be able to hear you. During the presentation, please mute and turn off your video camera. If you don't know where that is, it should be in the lower left of your screen. Background noise tends to distract, and if we have too many videos on, sometimes that interferes with the bandwidth, something I don't fully understand. And you can throughout put questions or comments in the chat. We will have time at the end for questions, and we're going to hold all questions till the end. But if you want to be able to remember, you can put it in the chat, and we'll try to make sure to get all those questions. When you're chatting, you can select chat to everyone, or you can select an individual. And this is something I learned during this time where we're on Zoom all the time. Even if you do a private chat to an individual, as the host, it shows up in my recording. So in case you want to chat something like that, Martha, I don't know what she's doing, I'll thank you very much, because I get to see that even if it's private. I always share that with people because that brings up how often we say something's private and it's really not. We always put this up here. The opinions are that of the presenters and not necessarily of N.A.P.S. And so without further ado, I'm going to introduce this webinar. This is actually the 45th webinar in our series. Like I say, the second in this series. Then on COVID-19 and as a catalyst for change. Our presenters today, Clarence Jordan and Dr. Lisa Kugler. Clarence Jordan is Vice President of Wellness and Recovery for Beacon Health Options. He received the Consumer Leadership Award at the Substance Abuse and Mental Health Service Administration 2010 National Voice Award, and in 2014 received the National Council for Behavioral Health as the Peer Specialist of the Year. Dr. Kugler is a licensed psychologist in the state of Pennsylvania. She's been active in the field of substance abuse and mental health services, providing direct care, executing administrative duties, and conducting research for over 25 years. Currently, she serves as the Clinical Vice President with Beacon Care Services. This role leads the strategic vision for clinical team within the provider affiliate to Beacon Health Options and enterprise-wide peer and integrated care programming. So without further ado, I'm going to turn it over to Clarence Jordan and Lisa Kugler, and we'll proceed.
Thank you so much, Martha. And thank you for all of you who are attending today. I noticed that there's a number of individuals from Pennsylvania on the call. So thank you so much for introducing yourselves. I'm just going to give you guys a shout out. And I noticed that there's also someone on from Pittsburgh, and that's the region that I'm from as well. So it's always great to see people from your own community coming to hear a presentation about something that I think is impacting all of us and really impacting the world that we're living in today. So thank you very much for coming. And I'm going to get started, and then I'm going to pass it over to Clarence in a little bit. We would like this to be interactive as well. So in points, I'll be asking you to go ahead and unmute because I'd really like to hear from you guys. This presentation is about all of us working together and all of us being the change that we want to see in the world around us as we all support each other through COVID-19. Next slide, please.
All right.
So for today, these are sort of the chapters that we'll be going through. First of all, we'll be talking about the impact of COVID, really looking at the economic, the physical, and the emotional impact that COVID has had, and how these really are different dependent upon different places you may be within the country, dependent upon marginalized groups. It's really impacted different people in different ways. We'll then be turning it over to Clarence, who's going to talk a bit more about peer support strong, peer support groups, how it works, and then I'll be coming in for the outcomes, and we'll both be together during the discussion phase. Next slide. Some of the goals for today, really understanding of COVID-19 and how this has impacted the entirety of the healthcare delivery system, but really focusing on peer delivery. Also, a review of the strengths of the peer specialist and how to incorporate those strengths into a system that at any point in time really needs it now. A little bit of a discussion about a pilot that we had done at Beacon Health Options around building virtual peer support groups, and then understanding some of these outcomes associated with the virtual peer support groups. Next slide. Impact of COVID-19. Before I actually start getting into some of the statistics, I'd love to hear from you guys. What do you think have been some of the impacts of COVID-19 on people in the United States? Anyone, feel free to hop on in.
Hey, this is Anna in Austin, Texas. I know down here, especially in the recovery field of peer support, isolation has been a real challenge for a lot of people that we've been talking with in our peer circles.
Absolutely, love it. What else have you guys seen?
This is Scott from Wilkes-Barre, PA. I experienced some of my individuals have fear and they don't want to go out even right to this day.
Yeah.
Julie in Augusta, Georgia, increased substance abuse.
Great, and that's one of those things that I don't think as of yet is really getting the attention that may be necessary, but it's one of the ways that people oftentimes deal with stress. So we're seeing a lot of it. And also, I mean, even with the opioid use disorder, individuals that may have used with others and had the Narcan that could be there for, you know, revival if something would happen, or if there was an overdose, we're seeing an increase in overdoses because there's not that community even anymore. People are more isolated, they're more alone, they're more afraid. What else are you guys seeing?
More depression, lack of energy, motivation.
Yep.
This is Colleen from Minnesota, and I'm a volunteer peer support for NAMI. And they've been receiving many, many more people who are having all of what was just talked about as impacts of COVID coming into their office needing peer support.
Yep. Increase in depression, increase in substance use. I know there's an increase in overdoses. I've also heard and actually even just kind of anecdotally seen that there's an increase in a lot of ways to address and deal with stress without all of them necessarily being healthy. A lot more overeating. There's weight gain. There is more sleeping. Cycles are disrupted. It's really been a game changer in the way that we interact with the world. What are others seeing?
Unemployment, increase or loss of jobs. A lot of peers that would normally be working aren't working anymore.
Absolutely. A lot more uncertainty. It's scary for some.
This is Stacy from Philadelphia. A lot of anxiety, kind of like what everyone's been saying, especially when it comes to lack of employment or the loss of employment, as well as food insecurities and the for those who are parents, how the kids will be going through school, if there's going to be school. So a lot of anxiety for a lot of different situations.
Yep.
I'll also throw in a positive. Sorry, did you want to?
Nope, go for it.
There's one of the positive changes has been, I was working at a methadone clinic earlier this year, and due to COVID, they were forced to look at the policies in place here in Texas, and they increased take home. They gave the clients their more agency as adults instead of it being infantilized into a very overseen process. And so they had to learn to trust their clients with an increase in take-home doses. And so far, I would love to see the actual data in that, but so far we haven't had an increase in overdoses from that population.
That's very cool. Exactly. It's impacting all areas of life. In the chat, it also had mentioned that there's decreased access to food banks. And because of a lot of the uncertainty, it can be difficult to kind of mentally be chimed for when this is going to end. It feels like it may never end, even though we know that it will at some point, but what that will look like and when is difficult to predict, difficult to tell, which kind of leads to the uncertainty also. Is there anything else that anyone would like to add? Is there any other positive impacts that anyone has seen?
I would like to add, this is Diane from Lebanon, Pennsylvania. It has changed the way I peer support with some peers. More engaging, like if the peer would say, oh, I need to wash my dishes, but I don't feel like doing it. I'll say, okay, if you are willing to get up and wash your dishes, I'm willing to get up and do mine. And we'll do things like that together, or go for a walk outside and use those mindfulness skills. What do you see, hear, smell, touch, things like that.
Very cool. It's challenged us to become better.
This is Sharon Bird. I'm calling from Hitchkin, Alaska, and I co-facilitate a peer support group. And since March, we've had to meet telephonically over the phone because so many of our people don't have access to virtual and all of that. So, like I said, we've been doing it telephonically, and my population has really dropped during this COVID time. It really, yeah, it just, yeah, it's very depressing to everybody, the isolation. So thank you.
Thank you. Anything else positive that anyone has sort of noticed?
Hi, this is Dawn Divern from Phoenix. We here, because we're kind of in a hot spot too right now, that what I've seen is parents really stepping up to the challenge. It's been kind of interesting to see. I heard somebody else say that they felt that parents were, or peers were engaging less. Here it seems like we're engaging a lot more. We're able to get on the phone more with people, and they can multitask while we're having our meetings. And so that's really been great for the community, as they've been able to share more about their world in a quieter, kind of different scenario. And it's really opened it up more to get more information.
Awesome. Thank you so much all for sharing. Martha, would you like to go to the next slide? You guys gave all of, or most of the responses the Kaiser Family Foundation have seen as well throughout their research and surveys. So basically the Kaiser Family Foundation should just hire us. We could have told them all this right off the bat. But you know, 41% of the individuals in the United States are feeling more stressed. It can be for a whole host of reasons. 45% report emotional well-being has worsened. So I'm going to stop right there for just a second. That's almost half of the population has reported that their well-being has worsened. And when you stop to think that 1 in 5 were already you know, having some significant symptoms to meet a diagnosable condition, this is huge. This is huge. Also, there's been a 34% increase in anti-anxiety medication prescriptions. Yeah, I heard that. That's a huge as well. You know, and 55% are feeling more lonely. When we move to the physical health side, because physical and emotion are definitely intertwined, 14% have reported their physical health has worsened. As we look at the anti-anxiety medication prescriptions, it could actually even be higher with the physical health, because you can have things such as upset gastrointestinal, sleep disturbances, migraines that are so intertwined between anxiety and stress and the physical responses that you have for them. 24% report the ability to protect their household has gotten worse, and 31% report the access to care has gotten worse. This is another staggering statistic for me. This means that 1 out of 3 individuals basically is having more difficulty getting to services that they needed. Especially initially, there was the elective surgeries that were put off. Many people were getting scared about going to the emergency department, getting scared about going to a primary care service. Now there's a lot of social distancing that's going on, so they may not be able to see everyone that they may have seen previously, and it kind of impacts overall health. If we look at financial, 11.1 is the unemployment rate as of June 2020, and almost 8 out of 10 individuals worry the pandemic will trigger a recession. It's actually really interesting, because I noticed in the chat, because I am trying to multitask here, that one of the individuals says, I'm actually doing better than before all of this started. Even though these are sort of the statistics, that doesn't mean that everyone's doing worse. And I think even as we were beginning to talk through this, there is good that is coming, that can be seen through some of this. There is some greater sense of community. We're challenging ourselves into how to become better. We're finding new ways to work with individuals. I am seeing telehealth expanding at a rate that I have never seen before. In reference to some of the substance use, there is changes that are occurring. I love what I heard about N.A.P.S and kind of looking at alternative ways to really embody and give the individuals their responsibility for their recovery and for moving forward with their recovery process, and not having it potentially feel as punitive. So those are some really cool unintended side effects, or cool unintended things that are occurring because of this, but it does not take away any of the pain that individuals may be experiencing. And everybody experiences this slightly differently. And it would be remiss for me to, not also highlight how this is really impacting Black Americans, Hispanic Americans, at a much, much higher rate than white Americans, and how this sort of embodies some of the ongoing racial biases, some of the unrest that's occurring, and makes people more vulnerable to a lot of the things that are happening right now, including the emotional, physical, and financial strains of the pandemic. Next slide. Okay, I got some feedback here from the chat box, so I want to go in here for a second. These are the numbers for the general population, not just those with mental health or substance use issues. And absolutely, medication-assisted treatment is more than methadone, Vivitrol, and Suboxone. Absolutely agree. We were talking primarily about methadone. I know that Suboxone also as well, some of those guidelines have relaxed during the pandemic as well. For antabuse, Revia, some of the other medication-assisted treatments, not sure how much those policies have changed, but I've been following the methadone and buprenorphine pretty closely. So looking at emotional toll, the single most prevalent reason for depression is isolation. And there are ways to be physically distant from each other without feeling emotionally distant, but it's very different than the way we're used to interacting. We as humans are group animals. We appreciate, we want that closeness, we crave that closeness. And I don't know whether there's ever been a time that has really illustrated that like the pandemic has. We are definitely seeing an increased number of people who are struggling with remaining calm and managing their frustrations and emotions. I think that any of us could probably go on the internet and see just some videos that are things that I've not seen in my lifetime, quite honestly. And maybe it's because I'm looking more, or maybe it's because I am following it a little bit more closely, but it just seems that some of the videos are more outrageous now than ever before. There's definitely been an uptick in domestic violence, anger, substance abuse, and suicide. There's individuals that their escape used to be being able to get away from a partner that was violent towards them. They may have been able to get out, go to work, etc. And now those outlets are being reduced, which is unfortunately really leading to a pretty strong uptick in domestic violence. Some of the most vulnerable populations are those with chronic medical or behavioral health conditions, those that already had economic hardships, and those without social supports. Any questions or comments sort of on overall tolls that COVID-19 has produced so far?
Hi, Hillary. You're scheduled for fit testing in the old deck at 3:30 today. You're scheduled for fit testing at 3:30 p.m. in the old deck, first floor. Okay.
I was going to say, I couldn't actually hear the comment or question. I do see in the chat box, are there actual statistics for these upticks in domestic violence, substance use, and suicide? I think that it's still a little bit too soon for the actual statistics. I can definitely look for those. It's a great question. We are getting those from hotlines, primarily suicide hotline, domestic violence hotlines in a variety of the states. And the overdoses is more, like I said, anecdotal in what I've been hearing sort of around, and individuals being found unresponsive, etc., and substance use in general. But great question. Okay, next slide. So initially, one of the hardest hit areas in the United States for coronavirus was New York. As per the Hopkins interactive COVID materials that are located on that website, as per Wednesday, April 8th, there was 149,000 total cases in New York State, over 6,000 deaths from the coronavirus in the state, and of that, 4,571 in New York City. Because of those specific statistics, Beacon Health Options looked to kind of implement a pilot project within New York, really looking at those individuals, knowing that that was likely at that point in time where there was going to be a lot of the anxiety, a lot of the stress, a lot of the loneliness. There was really, really rigid stay-at-home orders that were going on there, etc. Before we move into kind of peer specialist strong, I'd like to hear from you guys again. What are some ways that you've seen peer support change as a result of the pandemic?
Hi, I'm Candy from Edison, New Jersey. With the telehealth, I was not able to connect with the women I was making progress with. So with the approval of the higher ups that I work with, I start engaging in walk-in talks where I meet them at their house, we mask up, and we go for a walk and talk. And the engagement with that took off to a whole different level of connection where the communication and their willingness just sprung wide open. And I was amazed with that. So I don't think I'll ever go back to in-home. I think I'll be sticking with that.
I love it. That is such a cool idea, the walk and talk. And it's great. It's the exercise, it's the endorphins, it's the getting outside. And by doing something physical, it can lower those inhibitions a little bit so that they're just talking. How cool.
I know one of the things that we've had change here in Austin area, a lot of the peers, we've noticed there's that extra layer of stress for us as peer providers, meeting our own self-care needs and getting the support, because it's so, it's so easy for all these compounded issues to, and increased anxieties and all these other, the basic needs to be met are affecting us directly as well, because we are peers in our peer circle. And so one of the things that we've done is I'm going to be putting together a coaches corner, which is just a weekly group for people that are certified peers. So we can have our own meeting that we don't attend with our peer circle.
Love it. And that was actually one of the other things.
Everybody.
Oh, hello, go ahead.
Hi there.
I can, I don't know if anybody else is coming. I can get started. I was going to talk about Tammy Burkhammer for a couple minutes first. Elizabeth Hale is the fellow, but she has clinics, so she won't be here for a few meetings. I don't know if Jim is there, but we can hop on if there's anything else.
Please mute if you're not asking a specific question.
So, yeah, I'll just get started with Tammy then. So this is the first time.
Yeah, I think there's somebody that's not muted that could be.
Woman who was transferred to us from the 8th floor. She had had a very prolonged hospitalization at Presby. Originally,
I just wanted to react for a second whenever someone said getting, groups of peers together and each of you supporting each other that way. That was actually one thing that we started at Beacon Health Options as well, is the peers were used to going into the office and having a lot of other people to interact with, to do discussions around the members that they were seeing, to receive feedback, to be out in the field, etc. And that was really missed early on as we pulled everybody in-house and really did the work from home. So we started a Teams page with all of the peers enterprise-wide. We've also been having kind of, I don't want to call them lunch and learns. They've been more like coffee breaks on specific Fridays of the month to just kind of get together, talk about what's working well, how are you taking care of yourself, are there ways that we can help support you, sharing motivational quotes with each other, sharing newfound hobbies, and also doing some discussion on cases as well, sharing some of those success stories, so that we can continue to build enterprise-wide that ability to take care of ourselves while also really being the best that we can for our members. Okay. Well, thank you all for sort of sharing some of your unique perspectives. Really appreciate it. I'm going to turn it over now to Clarence.
Thanks, Lisa. I really appreciate that. And isn't she wonderful, guys? Isn't she fantastic? I'm gonna tell you, I know very few cool clinicians, and Lisa is one of them. And if you were with us last year at the N.A.P.S conference, you will probably remember her. Her energy is exciting. Her attitude regarding the things that we care about are just spectacular. I have to admit, just looking at those numbers, just hearing that impact, it can be somewhat daunting. It can be depressing, even. So when we think about peer support and or peer support specialists being strong, to counter all of that, depressing news, what's the one word that comes to your mind that would serve as a counterweight? And let me tell you, there were 5 of you whom I have identified already who correctly used that word, and we're going to be calling on them just a second to figure out what that word is and how they used it. What's the one word? Anybody? 5 seconds. Okay. Our candidates are Beth, Julie, Sharon, Diane, and Neil. You all used words or used this word in your response in the chat room. That word is hope. That word is hope. Beth, you want to tell us how you use the word hope? All right. Beth writes, maintaining hope because it's hard to see the end to this. Julie, would you share with the group how you use the word hope?
I said that I hope to learn some support techniques that I can offer to the peers that I serve, as well as some that are new to myself, because I find myself being kind of out there without any support.
Excellent. How about you, Sharon? Do you want to share with the group how you use the word hope? Sharon writes, positive change that we hope to see at the end of these very, very difficult times. Diane, how about you?
I'm hoping to engage the peers and help them overcome COVID and their fears and struggles.
Absolutely. Neil, how about you?
I'm not sure how I used it.
Hoping to learn more about peer support.
Oh, yeah.
So
I'm not in the field right now. I just started a master's program in psychology, and that's what I hope to go into eventually, maybe with the VA. So that's why I'm on here now, trying to learn more about it.
Well, let me tell you, if you're wanting to go to the VA and you want to learn more about peer support, there's not a better laboratory in which to learn.
Okay, thanks.
VA, as you probably know, employs hundreds of peer specialists. And, I might say doing a fantastic job over there at the VA as well. So thank you, Neil. I appreciate and applaud your going to work and to help out our vets. The one counterweight to all of this depressive news, in my opinion, and thank you all for participating in our little informal survey here, is hope. Next slide. You've all seen this, right? Or you've heard about it. The term is Helper Therapy Principle, HTP. And I don't know about you, and I'm gonna leave that up for a minute while I share some information with you. Martha read in my intro that I was a recipient of the Peer of the Year Award from the National Council, and I don't brag about that award or anything, and quite frankly, when I think about it, I think it's perhaps more special to the individual than for anybody else. But only in this one instance, have I read of late what I consider one of the stars in this industry. It's a gentleman by the name of Nicholas Addison Thomas. He's out of Johnson Mental Health Center. He's after spending 27 years as a first responder, Neil, as many of us do, kind of lost his way. And he himself confused, lost, lonely, and subsequently diagnosed with a mental health condition, depression, PTSD, anxiety, alcoholism, and drug. After spending a period of time in a treatment facility, Neil emerged and thought about his past life as a first responder, as a firefighter, and said in the interview for his award, I wanted to get back to that place where I could help. I wanted to get back to that place where I could help. When asked, and all of us are, what is a perk? What is one of the perks for being a peer specialist? What's a perk for being a peer specialist? Nicholas responds in this way. It's amazing that people gain the hope that they too can recover and lead a life of worth and dignity. I want to applaud Nicholas in the work that he continues to do and his receiving this year's Peer Specialist of the Year Award. This principle, the helper therapeutic or therapy principle, is the backbone of the work that we do as peer support specialists. And I suspect many of us on this call are peers. And let me say to you that I really appreciate and also acknowledge that this work is very, not only because it helps others. But we get to enjoy just an amazing sense of gratitude, self-worth, you name it, as a result of helping others. Next slide, please, Martha. Strength versus deficit-based approach. There are national practice guidelines that I'm sure all of us are familiar with. And and the most significant of these, we're gonna name one by one. And so Martha, if you would, what's the first one? Peer support is focused on the strength of those they support. That comes as no surprise to you, does it? Following that, peer supporters use their own experience to demonstrate the use of one's strengths. How many of you, hold it right there, if you don't mind. How many of you have ever used your personal story to help someone? Rhetorical question, I know, because many of you do exactly that. And for many of you, you know that it's that strength, it's that how we made it over that really attracts others to want to believe too that they can recover, to believe too that they can have hope. So it's no surprise that in terms of moving people up that journey, up that ladder, across that recovery, that one thing that peers have, their personal story, is a strength-based perspective. And it's those strengths that we should always remember to share with those that we serve. Next bullet, please. Peer supporters encourage others to explore dreams and goals. Again, not surprising to many of you out there, I'm sure, if you're a peer specialist. Next one, Martha. Peer supporters operate from a strength-based perspective and acknowledge strengths to inform choice and decision-making of peers as a foundation of recovery. And the next bullet, peer support is mutual and it is reciprocal. Simply stated, when I help others, I too benefit from that. I too benefit from that. And just like Nicholas said, it's amazing. It's amazing when you can watch or when you can observe others find that hope that they need to soldier on. Next slide, please, Martha. How does it work? Okay, good question. I'm glad you asked. Next question, next slide, please, Martha. Traditional peer support. When I thought about, Lisa and I were working on this pilot, and we talked about the use of peers, and and possibly, what's the one thing that peers hold in common is that many of us have participated in self-help programs or 12-step programs. And it's from that perspective that we wanted to work with the individuals. Because if they've had experience working at 12-step, then they were the right candidate to be for this pilot. Why? Because traditional 12-step groups are conducted face-to-face. You need to travel to get to a meeting site. Most support groups rely upon just one facilitator. Typically, only a single support therapeutic is offered. Typically. Most mutual support groups are deficit-based. What do I mean by that? Well, I was told when I was in the room that, one thing I need to focus on was I need to focus on stop drinking. Just don't pick up a drink. It's one day at a time. Just don't pick up a drug. It's one day at a time. Don't drug don't drink, avoid aberrant behavior, sexual deviancy. The other thing is passing the plate. One thing you can always count on, and that is if you go to a 12-step group, they will pass the plate. Why? Because they're all self-supporting. It's all self-sufficiency. We don't ask for anyone to donate the coffee. Oh, well, we do, but the idea of collecting money is to pay for those donuts and that coffee and that sugar, those creamers. So if you participated in one of those, you were the right person. Why? Because most of us, when we think about our early experiences in the rooms, most of us have voiced some similar experiences or takeaways as are here. These are traditional support group takeaways. Next slide. On the other hand, because you've experienced that, you become a perfect candidate for this. And this is a co-facilitated virtual support group where we no longer focus on deficit-based. We're no longer talking about stop doing this or stop doing that or avoid that or go there. What we're talking about and what we're focusing in with respect to a virtual support group is the one thing, is the one idea, is the one strength that peers have in common, and that's that's strength itself. Co-facilitation was for this group, for this pilot group, a 5.5 hour training. We used much of, I would suspect traditional co-facilitation tenets. And they are task functions and they are maintenance functions. And if you participated in the N.A.P.S peer specialist training, you would have seen this. These two functions, this task function and this maintenance function, requires practice, intuition, excellent communication. And when you do it right, as I observed our facilitators do, it's a sight to behold. It is a sight to behold. The impact on the group is stimulating, it's purposeful, it's engaged, it's fulfilling. In short, when co-facilitation is done correctly, maximizes adult learning principles. What are those principles? Well, we know from research that adults, you and I, like to learn when it's fun. You and I like to learn when it's something that we really need. I was talking to a friend of mine the other day who has become a millionaire playing the stock market. Well, I doubt seriously that I could ever become there playing stock market. She's been at it now for over 30 years. But there are some things that I was confident that she could teach me so that I could have an opportunity to have perhaps pass that knowledge on and to maybe introduce my kids, my sons, to the idea or the notion of saving and investing, because there's such an uncertainty in the world today. And without pre-planning, without conscious thought to the things that we do, we can come with some hard knocks in life, and that is a certainty. So adults learn what is necessary. They learn when it's fun, and they learn when they participate. So the end goal for our facilitators, what's this? That we wanted them to have fun. That was job one. They had to have fun. If they didn't feel they could have fun doing this, then they probably weren't a good candidate. We wanted them to facilitate the group in such a way that the participants, the emphasis was all on the participants. We needed the participants sharing. We needed the participants responding to the topics. And their job as facilitators, co-facilitators, was to encourage that, was to support that, and was to introduce that in a way to elicit that kind of response from the group. And we wanted facilitators, certainly, excuse me, who had the maturity and skill sets to be able to empathize when situations presented themselves that required empathy. Situations presented themselves that required an empathetic response. Co-facilitation in virtual space. Next slide, please. What are the benefits? Well, I attempted to capture some here. Again, tells us that there are many, many benefits from doing virtual support as opposed to traditional support. There's the fluid information exchange. There's the continuous availability for those individuals who are participating in virtual support groups. They're continuously available. They can be. Greater access. Just like telemedicine has helped patients in rural or remote areas access care, support groups can provide help for those unable to travel to in-person meetings. More anonymous. I don't suppose you know anyone in recovery felt a little bit, I don't know, shy, maybe a little bit lacking in self-esteem. I worked early years here in Memphis with a group over at a facility called Lowenstein House. And I remember facilitating groups over there frequently when sharing. Individuals over there would cover their face, would cover their mouth, share. It was something about how the medication had enamel on their teeth that they didn't want to people to see. There are a lot of people for any number of reasons who don't participate in face-to-face groups, particularly if they have a diagnosis. You can provide the same support that you get in face-to-face groups. And in addition to that, you can also provide additional support. And so it so happened that in our groups, that in our virtual support groups, not only did we provide that virtual support space through co-facilitation, but we also had clinical backup. That is to say that we assigned a clinician or had a clinician who also identified them, you know, and they're on the line and they're listening. And if people needed, you know, help, I mean, you know, the clinician, so we could step out of the room, so to speak, with this individual then in the care of a clinician to address those immediate concerns that individual was having. So as to maintain the integrity and continuation of the group as it was being facilitated. Any questions about the benefits? Anybody? Comments or questions? Okay. Next slide, please, Martha. So what does a good virtual support group need in order to be successful? In our case, because it was a pilot, we wanted to do a pre and post assessment. We wanted to have specific criteria for those participating in the group. That criteria, simply put, was whose facilitators had worked with, that were appropriate for a support group. What does that mean? I mean, individuals who were, you know, if they were experiencing, you know, the negative effects of their, they would probably not be a good candidate for this group. If they're individuals who were still using alcohol or still using drugs in an inappropriate way, that they would probably not be good candidates for this. Virtual support and for the facilitators. I mentioned that we did, you know, facilitator training. We not only had, you know, that 5.5 hour training, we also provided the facilitator an outline. Excuse me. Informed consent form was necessary, was needed for these groups, and a brochure that explained in full detail what virtual support was going to do or would provide. And many of the things were included in that brochure were the benefits that I just explained or just shared with you. The most significant one, which in my opinion, the idea of anonymity, because based on my experience, when conducting support groups, you get one or two individuals in there who's sharing, and guess what? If you're not on your P's and Q's, 2-3 people can dominate a room. 2 or 3 people could dominate a room. And so for what do you do for those other 12, maybe 13 individuals who are there that don't have or don't feel they have an opportunity to get a word in edgewise? That's why you need a co-facilitator, one who's responsible for tasks and also one who's responsible for maintenance, to observe and notice that that individual might want to have something to say, might want to participate. And you can see that in virtual time. You can see that in virtual space, because just like we can see you and the things that you wrote in response to what do you hope to get out of this group, we could do the same thing in this virtual space. We provided a suggested topic list, all of which strength-based, and there was a peer feedback survey so that those that participate could tell us, in effect, how they about the group itself. We'll get to that here. Any questions? Next slide. So, once again, introduce my co-facilitator and partner, and we've done these groups now for a number of years, Dr. Lisa Kugle. Lisa?
Thank you so much, Clarence. And for everyone, isn't Clarence awesome too? He is always wonderful, and I just love hearing his stories. We're going to talk a little bit about the specific virtual peer support pilot that we did with Beacon Health Options. And one thing I really want to kind of emphasize is that there is not only one way to do virtual peer support groups, and there isn't kind of one right way, one wrong way, anything like that. It's really what works best for the group that you're involved with. What is the best technology? What's the best platform to really engage individuals? I have to say, I am absolutely loving this presentation so far, and what I'm seeing from you guys. I am seeing all kinds of banter going on in the chat boxes, back and forth. And this is what we really mean by peer support and support groups. They're not all going to look the same. And I'm hoping that even as we continue and move throughout today, that some of this goes with you, and that this in and of itself can become a little bit of a support group. You're reaching out, you're meeting new people, you're finding out how they're doing things, and if that will work for you or your organization. This is what support is about. Next slide, please. A little bit about the virtual peer support group that Beacon Health Options did. We as I mentioned initially, we looked at one of the hardest hit areas in the COVID-19 pandemic, which was the state of New York. So we looked at those individuals, those members that were currently engaged with intensive care management services, and we began to look at what would be necessary to really provide a virtual peer support group. This group was co-facilitated with 2 peers that were on Beacon Health Options staff. And the group was really designed to reduce loneliness scores and to support members on the issues that they may have been addressing at that point in time. There were 50 individuals that were offered the group. 28 said that they would be interested, and of those 28, 11 actually participated in at least one of the sessions. Although it may seem that that's a low number, 11 is almost half of the 28 that said that they would join. And, as we were discussing earlier, there is so many struggles that they were looking for hope. They were looking for that connectedness. They were looking for something that could help them feel better. So they were really willing to try kind of a virtual support group. Next slide, please. One of the things that we encountered was limited attendance during the first several weeks. So we began doing texting reminders 2 hours prior to the group, because people were saying that, especially with the pandemic, with some of the loss of routine, they were losing what day it was, what time it was, when to call into things, etc. We definitely noticed an uptick in individuals' ability to attend the group when we were doing the text reminders 2 hours prior to the group. We also, because of the low attendance during the first few weeks, expanded the initial run of sessions was going to be 6, but we did expand it to 8. Oh, I love this. This just came through on the chat box. Worked with an agency that kept worrying that the support groups may be process groups. Are there clear defining characteristics that ensure our peer groups stay in scope? That is such an awesome question. That was part of the training that Clarence talked about doing, and it really did. It focused on the individuals sharing what their experiences were. It did not go into interpretation. It talked about what is the strengths and how can they share those strengths with the group. Being a clinician myself, I did not feel that it crossed really any lines into more of that process group. There weren't any of the interpretations made. There wasn't any homework assignments. It was really nothing like that. It was absolutely, how do we support you through your day? It would start with kind of a motivational, I don't want to say speech, a motivational quote. The group would talk about what that quote means to them, how they can incorporate it into their life, or what are the things that they're currently doing. Some of the topics talked about is coping with stress, finding purpose and meaning in a new normal, how do you deal with grief and even grieving some of the things that you may have lost? How do you deal with isolation? So it was very focused on specific topics, but it was not looking at any of those deficits. As Clarence mentioned, it was really focusing on the strengths. Next slide, please. So I am so proud of the facilitators, the supervisors, Clarence, everyone for putting this group together. As I mentioned, it was a low number of individuals that attended at least that 4 sessions, but of the individuals that did, 100% of the individuals that attended at least 4 sessions reported that they felt the groups were helpful. In addition, 100% of the individuals that attended at least 4 sessions felt that the groups assisted with their feelings of loneliness. They said that they felt more connected after the groups. They came away with kind of new ways to think about things. They came away with new coping skills that they might not have thought of. they felt like they were sharing a part of themselves with the group. They brought their pets to the group and shared that as well. It was a very, very cool experience for me, and I hope for the peers that were co-facilitating, and for Clarence, as well as obviously the members too. An interesting sort of side note, what we noticed then from the peers who were co-facilitating, as we have more and more of our enterprise-wide meetings, we find that those two co-facilitators are oftentimes the first two to speak up, the first two to offer suggestions, the first two to do presentations, the first two to really jump in and be there for others, which is really cool to see their growth as well. For those of you who are not familiar with Net Promoter Score, this looks at the number of strong promoters, which are 9 and 10 on a scale of 1 to 10, versus those are detractors, which is, I believe, 1 through 5 on a scale of 1 to 10. And you take the promoters minus the subtractors, and that gives a Net Promoter Score. All of our individuals that attended at least 4 sessions fell within that middle range, so they didn't become a promoter or a detractor, but they were all in that 7-8 range. So they didn't quite hit the promoter side, but they were definitely favorable in reference to the groups, and they had acknowledged on the assessment at the end that they'd like to continue to be engaged in groups, or if we do another similar group series, that they'd like to participate. Next slide. So in conclusion, for the individuals that we reached out to and those that participated, they all stated that the group was helpful. Facilitators enjoyed the experience as well. We had debriefings with the facilitators both immediately after the groups and then at the kind of conclusion of the 8 sessions. And, you know, one other thing we do want to caution is that the results need to be interpreted with pretty significant caution. This was a very small N, and there were, you know, co-facilitator competence enhancements. We recognize some areas that, you know, it's difficult to think through everything prior to doing it. And we definitely found as the groups continue to move forward that the co-facilitators became much more comfortable with one another. They became much more comfortable with delivering things on a virtual platform. They became much more comfortable with one taking lead and one doing the dancing, basically, and helping with the maintenance and the task. And it was really, like I said, absolutely beautiful to watch the growth as the series progressed. One thing I do want to mention, because it came up before, asking about technology. For the virtual peer support group, we did not mandate that anyone had to, you know, use the computer, use the Zoom, use any specific type of technology. They were given both the Zoom access information so they could video in. They were allowed to use an avatar and basically a alias if they chose. We did have to know that on the back end just in case there was any potential concerns around risk to self or others. We needed to be able to identify them. But you know, they could use an alias within the group, or if people wanted, they could even call in and just do audio. Within the state of New York, there were free cell phones that were issued. So most of the members did have at least access to telephones if they chose to just engage through a telephonic call-in versus the full virtual experience. And, you know, we did have some people that were video, we had some that were telephonic only. And as we became more comfortable actually facilitating the groups, it flowed much more smoothly, say on session 8 versus, you know, session 1. So next slide, please. Now we'd really like to turn it over to discussion for you guys. Any questions that you have, any stories that you'd like to share, any successes that you've really seen with your agency doing virtual support groups, any things that you've seen, please feel free to chime in at this time, or any questions that you have for us.
Lisa, I did see one question out there. Will these slides be made available at the conclusion of today's presentation?
Actually, the slides are already posted on the I.N.A.P.S website on the page that says past webinars, and that's in preparation. Eventually, this video will be there too, probably later today or tomorrow, but the slides are there right now.
For those of you that had specific questions or goals that you hope to achieve from today's webinar, were you able to get those questions met, or did it meet the goals? Because we'd really like to hear from you at this point in time if there are other things you'd like to see or hear, especially because I'm hearing from everyone that's on the call that you have a wealth of individuals that have a ton of information right here, and it's a great place to ask some of those questions. I actually just saw one question come over. How are crises handled that come up in peer support groups? I can only speak to the one that Beacon Health Options had done, so I'd love to hear from any of the other organizations that are out there. We did have a workflow developed, and as Clarence mentioned, we did have one clinician that was on the phone. If an individual would have stated that they were planning on harming themselves or someone else, or there was a high-risk situation that needed to be immediately assessed, we had a workflow in place that we would have IM'd the clinician that was on the phone, asked them to call the individual directly. We would have let that individual know that they were going to be receiving a phone call. We would have then put them out of the group as soon as that new phone call connected, and we made sure that that connection was made. We also, as part of the consent in, asked each individual where they were going to be taking the group from. So in case, once again, somebody had a high risk or made a statement that appeared to be high risk and then they just hung up, we would be able to do a wellness check on them. Once again, the clinician really initiating that. Is that helpful?
There's one question, Lisa, that's a little bit out of our scope, and it related to, is there work being done to increase internet access in rural areas and those without means to purchase? And I think the one example that you gave was that in New York, there are free cell phones made available to individuals. I don't know of any specific initiative to specific, that is, to increase access to rural areas. Just generally from what I know from reporting, 5G, and I know a little about that, will bring greater access to rural areas and internet speed for everyone.
I'd like to chime in on access. I know virtual meetings, people get hung up on the idea that, you know, to attend these virtual meetings, you need internet access. But one of the platforms that is HIPAA compliant that we've been using is the professional level of Zoom. And, it's really affordable, and they've taken care of most of the hiccups that, involved Zoom bombing or people coming in that weren't supposed to be in the groups and what have you, because there's now password protection and the waiting room enabled or you can't have the meeting. But also people can just call in from a landline and participate in that meeting. And, just it's a matter of letting people know that it's not necessary. I don't know if anybody else uses a platform that has that feature as well for their meetings. I'd be interested in knowing what other virtual platforms people are using.
Just so you know, we use Zoom too. We use Zoom for healthcare. That was the platform we used, and it was great because, like I said, it was a really good experience, whether someone was calling in from a landline, from a cell phone, or whether they chose to go kind of the full virtual experience. And Neil, I saw that you had mentioned about learning what it's like to be a peer specialist, and heard about your interest in the VA. That's where I actually worked for a number of years prior to coming to Beacon Health Options. So if you ever want, feel free to reach out to me about what it's like working within the VA system. Clarence, anything that you would like to add?
I was searching for additional questions, Lisa. I find none. As always, joy to participate in an INAPS event. The work that we do in support of peers here at INAPS, I think is not only necessary, but it's also very responsive. That is to say, many individuals have struggled with becoming a peer support specialist, or they have concerns regarding peer support specialists. And I've found no organization any more responsive to the needs of peers and those who have inquiry about the use of peers than INAPS. So to my friends at INAPS, Martha and your crew, my many thanks, appreciation for all the work that you do.
Thank you, Clarence and Lisa. Thank you so much for this presentation today. I think people got a lot out of it. And Clarence and Lisa have presented, I think, at our last 2 conferences, definitely, and maybe more than that. And actually, I wanted to say this presentation and this series of 5 webinars were all proposals that were submitted for the conference, but I felt that they really needed to get the information out now while we're still in this, and we don't know how long we'll be in this. So I'm really glad that they were flexible and able to do this as a webinar. And I thank you all. Our INAPS webinars are always free. However, to get a certificate that shows your contact hours, you must be a member of INAPS. Membership right now is $35 a year. There are webinars on our website, recorded webinars, and this one will be. Like I think we have numbers 11 now through 45, and those are all available for anyone to look at. And if you want a certificate and you're a member, you can get one, and you'll email this membership@inaops.org. INAPS is almost exclusively volunteers, so please take that in mind when you're emailing us and expecting an immediate response. Most of us have other jobs as well. And I want to thank you very much. I don't think I ever introduced myself, but I'm Martha Barbone, and I was so happy to be here to moderate this webinar today. You'll be seeing news from INAPS very soon, and we hope by the end of this month, we'll actually be transitioning to a new website and a platform that allows more networking among members. But this right now, if you use peersupportworks.org, it will get you to the current website. And once the new website is up, peersupportworks.org will get you to the new website. So if you want to make note of that. And like I said, the slides, if you go to peersupportworks.org or inaops.org, you'll see a tab across the top that says webinars, and under that is one that says past webinars. So all the recordings are under past webinars, and future scheduled webinars are on the main webinars page. Our next webinar in this series is August 26th. So if you're interested in that, please check it out and register for that as well. And at any time, if you have any questions, please email membership@inaops.org. Can answer membership questions or webinar questions or just general questions. And the other place is info@inaops.org. And I thank you very much for everyone who attended. And I hope you have a nice day. And thank you again, Lisa and Clarence. Wonderful presentation.
And thank you.
Thank you.